From one war to the other, Israel is facing a mounting mental health crisis within its military. After 2 years of the war in Gaza, new data from Israel's defense ministry and major healthcare providers shows a sharp rise in the post-traumatic stress disorder, depression and suicide attempts among Israeli soldiers and reservists. And the numbers are shocking. Since September 2023, PTSD cases among Israeli troops have risen by nearly 40%. Officials now warn that this figure could surge by as much as 180% by 2028. These numbers are clearly worrisome for Israel because it remains engaged at multiple fronts in Gaza, southern Lebanon and Syria, with tensions now also simmering once again with Iran. For Israel's military, the war has become not only a battlefield challenge, but a psychological one as well. The scale of deployment has been unprecedented in recent decades. In the 2 years of Gaza war, Israeli forces clashed repeatedly with Hezbollah across the Lebanon border. While maintaining operations in Syria, Israeli officials say that more than 1,100 service members have been killed since then. Israel's defense ministry says that of more than 22,000 troops currently being treated for war-related injuries, roughly 60% are suffering from post-traumatic stress. Healthcare provider Maccabi reported that nearly 4 in 10 Israeli military personnel under its care sought mental health support in 2025. More than a quarter reported symptoms of depression, and the crisis is now visible in the suicide statistics as well. An Israeli parliamentary report found that between January 2024 and July 2025, at least 279 soldiers attempted suicide. That was a sharp increase from the previous years. Combat soldiers accounted for 78% of all suicide cases in 2024. Mental health professionals say that soldiers are grappling with two overlapping forms of trauma. The first is fear, the fear of death, a fear that does not fade even after returning home. And the second source of trauma is moral injury. Psychologists describe this as the damage done to a person's conscience when their actions, even under orders or in combat, violate deeply held moral beliefs. And then, access to care remains a major hurdle. To receive official recognition and long-term support, Israeli soldiers must appear before a defense ministry assessment committee, a process that can take months. Trauma professionals say that the delays discourage many from seeking help. Israeli Defense Ministry says it has expanded mental health budgets, increased staffing, and widened access to alternative therapies. But the demand is outpacing capacity. Israeli forces remain deployed across more than half of Gaza. Despite intermittent ceasefires, troops continue to occupy parts of southern Lebanon as well, under a separate U.S. brokered arrangement. Israeli soldiers are also stationed in expanded zones in southern Syria. Now, with tensions rising again between Israel, Iran, and the United States of America, the prospect of further escalation remains real. And for Israel's military leadership, the challenge is no longer just about winning battles, but preventing a long-term psychological collapse among those who are sent to fight them. Because even as the guns fall silent on some fronts, the trauma of war is proving far harder to contain.